They want to believe it's never going to hit them. But be realistic and start caring about other people a wee bit.
Irene Cairns has been in hospital for 2 weeks and still needs help to breathe. The 78-year-old says she rarely left the house before she developed COVID symptoms, and she arrived here needing emergency care. She knows her son at home is extremely worried.
David wanted to come and visit me here. I said, no, we're not taking that kind of chance.
The new strain of coronavirus has seen hospital numbers rise in January to their highest level of the pandemic. This is taking its toll on staff already dealing with the normal winter pressures. Since Christmas, Paisley's Royal Alexandra Hospital has been almost full to capacity each day.
I've seen a lot more younger patients, and particularly one that stood out to me is pregnant ladies are certainly at risk, and why that's the case I'm not sure, whether people are taking less precaution with the second wave than they were with the first wave, but certainly the demographics of people has changed.
Yeah, I'm struggling with it because we're seeing a lot more death and dying. I am used to maybe having one death a month, and now we're seeing several deaths in a week. On one level, I've become a bit desensitised to it, but you'll never get used to the death and the dying and the loneliness of patients because they're not seeing their relatives.
Staff sickness is adding to this strain. Here they say filling the rotas for each shift is as tough as keeping the wards COVID-free.
It's wards that have literally no staff, or they have one trained nurse to look after 30 patients, and that happens day in, day out at the moment. There's never been a time that I've ever had to think about what resource is available, what nurses are available on the scale that we currently do.
Obviously we've got quite a few nurses in the hospital and doctors and HPs. People are obviously going off with COVID symptoms. Probably, I would say I'm seeing more now than I saw at the start. For the nursing staff, I think we're all very weak. The ones that are coming back, we're trying to give some annual leave as well, because coming back to 3 12-hour shifts on the trot is hard going. Thank you.
To ease pressure, this new unit was set up, which split the emergency department in two. In the last few weeks, a new rapid COVID test has been introduced. Within 45 minutes, staff can identify positive cases.
The patients can be identified that are at risk and those that aren't at risk, and that allows ease of transfer from the emergency department further forward into the rest of the hospital and removes the backlog that we were having within the department.
There's still been quite a few numbers coming through SATA, and there was more positives the other day than negative patients, so I think we're still maybe in the middle of it. I don't think we're quite over it yet.
One of those positive cases is 52-year-old John McAllister, who also has COPD.
It's really my breathing. When I'm doing anything, I'm really exhausted. If I walk maybe to about here to the door, I'm out of breath as if I've done a marathon. My niece as well, she's got it off of me as well, and she's got a bad asthma. So yeah, it's quite quick the way it's spreading as well. And one of my friends in work as well has got it as well.
I think for us, I think we all feel that this wave has been harder. I think some of that is that patients do seem to be sicker this time round. I also think we're just really tired.
A boost to staff morale are patients who are well enough to go home.
I'm feeling grand.
Jim socialised with his neighbours at New Year. All three developed COVID symptoms. Only the 80-year-old ended up in hospital.
Believe you me, after the necessary time spent here to get better, I am ready for the out. In here has been a godsend.
As one patient leaves, there's another waiting to take their place, with the demands on staff here greater than ever. Sharon Frew, STV News, Paisley.